Welcome to Centering Pregnancy. Here, you and a group of other moms-to-be and their partners will share learning and experiences to take care of your baby and yourself. This is a proven program that leads to better birth outcomes and fewer preterm babies. Here, you'll get your education, your clinical care, and maybe most importantly, friendship and community. At each of your 10 group meetings, you'll be involved with your own care, learning to take your own blood pressure, weight, and BMI. You'll receive a one-on-one health checkup with a care provider, where we'll listen to your baby's heart, measure the uterus to assess growth, and discuss your individual needs.
So when patients first come, they're responsible for gathering their own vitals and keeping them in their notebook. So they go to the scale first, if it's available, and then they do their own blood pressure cup. And then after they gather their vitals, then they go to the provider in the room and have an assessment of how the baby's doing as far as listening and measuring the height of the fundus to see how far along they are measuring, as well as listening to the baby.
It's really important to be part of your own health care, and up to now, most of the time when women come in during their pregnancy, things are done to them. So someone asks them to sit down, someone takes their blood pressure, someone puts it in a computer. They may never even talk about what it was and what's normal. And so by knowing those things and by feeling empowered to do those on your own, then you feel like you're taking part of your care, and that may make you feel better about how healthy you have been, and it might may help you make some changes.
Here you get to learn and share with a community of moms-to-be who all share similar pregnancy timelines and similar challenges along the way. Your group meetings will cover a broad range of topics. In Session 1, we discuss prenatal testing, nutrition, size of your servings, keeping a food diary, and making healthy lifestyle choices. In Session 2, we cover body changes in pregnancy, common discomforts, taking care of your back, and healthy gums and teeth. In Session 3, we talk through mental relaxation, breastfeeding your baby, and the family you want to have. In Session 4, we discuss thinking about your family, family planning, sexuality, domestic violence and abuse, fetal brain development, and preterm labor. In Session 5, we cover labor, birth facility, breathing, medications for labor and birth, and early labor and when to call. In Session 6, we talk through the birth experience. In Session 7, we discuss your newborn's first days, planning pediatric care, caring for your baby, circumcision, brothers and sisters, and newborns and when to call. In Session 8, we cover pregnancy to parenting transition, kick counts, emotional adjustments, postpartum depression, and pregnancy, when to call. In Session 9, we talk through putting it all together, newborn safety, and infant massage. And in Session 10, we discuss newborn care, growth and development the first month, home and family changes, newborn, when to call, and mom postpartum and when to call. Remember, this is not a class. It's a discussion facilitated by the women in the group and their medical providers that is based on the needs of the group. The wisdom is with the women around you, and discussion will give you the tools you need to make the right decisions for you and your baby.
Given that it's a mix where some moms have multiple children and others this is their first, you learn a lot about the different experiences that they've had, and that even sometimes each experience is different with each child. So there's not really any wrong or right way to go through pregnancy. You have other people in the room that you kind of feel like are going through it with you. So it's a really great support.
The other people in the group, they were very insightful. They shared their stories and gave their opinions of their experiences in motherhood, and it actually helped me get through the anxiety of it, because it was, tough. It's my first time being a mom, and I didn't really know anything about it. Talking or actually having discussions with the other moms helped me to figure out the ins and outs of motherhood and what you do and don't do when it comes to babies.
It helps to empower them with the knowledge that they need to take care of their unborn child, as well as what to expect when they have the baby and how to take care of that baby.
The group schedule follows the same schedule you would have in traditional appointments, first every month, then every 2 weeks. You'll receive your schedule on the day you enroll. If additional visits or ultrasounds are needed, they will be scheduled separately. Finally, a party will bring all our mothers and babies back together to celebrate the new arrivals.
It's really nice to be able to come and you don't just go into an office with the doctor and they examine you and then you're gone, or you're sitting in a waiting room by yourself. You get to come in here, and while everybody's doing their prenatal care, you get to hang out and talk to the other moms to be in the room. It's like a little family.
So traditional appointments, the one-on-one appointments where we wait forever in the waiting room and then we see someone for 5 minutes, that's the way it's always been. But here you get about 10 times the amount of face-to-face interaction with your provider and nurse than you would in your whole pregnancy otherwise. So women who come through centering pregnancy receive incredible support. They receive medical support, emotional support, both from the staff and from the other women and support people in the group, and they walk away here ready to be great parents.
Centering Pregnancy is a caring and compassionate group of women and their partners, supported by professional staff and years of best practices. This is an opportunity for you to gain valuable knowledge to help you take care of yourself and your baby. We invite you to ask about more information today and to see if you can sign up for our 10-session program. Thank you for your interest, and good luck to you and your baby.